A cardiac ablation procedure is used to treat arrhythmias or irregular heart rhythms. Cardiac ablation is used when abnormal heart rhythms don't respond to medication. Cardiac ablation is used to treat fast arrhythmias, but is not the first choice of treatment. Usually medications are tried first. Atrial fibrillation and atrial flutter are relatively common problems. Other rhythms can go very fast. Once a heart rate starts going too fast, blood can't get into the heart fast enough and cardiac output decreases. This can cause shortness of breath, fatigue, chest pain, and a host of other symptoms. The human body is amazing. The timing system for your heart is complicated and precise. Sometimes that timing system fails or gets damaged. A normal resting heart rate is 60 to 100 beats per minute. Some rhythms can go as fast as 300 beats per minute. Long-lasting or repeated bouts of that can cause damage to your heart and can lead to more dangerous rhythms. Contributing factors are many and include diseases such as underlying heart disease, high blood pressure, diabetes, and age. Lifestyle factors such as smoking, excess alcohol, caffeine, and even stress can trigger them. Before a cardiac ablation procedure, you will need to stop taking blood-thinning medications like aspirin or warfarin, and will do that based on the cardiologist's advice. You need to stop eating or drinking for several hours, usually after midnight before your procedure. Someone will have to take you home from the hospital after the procedure. Wear comfortable clothing and leave jewelry and valuables at home. You will get an IV in your arm so you can receive sedation or anesthesia, and you will be relaxed or completely out for the procedure. A thin catheter will be inserted into a blood vessel, and x-rays or other imaging will be used to guide the catheter into your heart. They will map out the problem area so they know which tissue to treat and use the catheter to treat the abnormal heart tissue and block irregular rhythms. Once the ablation is done, the catheter will be removed from your blood vessel. The cardiac ablation procedure usually takes 2 to 4 hours to complete, but sometimes can take longer. The exact length of time varies from person to person. You will be monitored in the recovery room for several hours. You will need to stay in the hospital for 6 to 8 hours after the procedure. Depending on your condition, you might go home that day, or you might have to spend the night in the hospital. You may be prescribed aspirin or other blood-thinning medication to help prevent blood clots for several months or even longer after the procedure. The success rate depends on the abnormal rhythm. Cardiac ablation risks are low, but they do exist. Your cardiologist will discuss those with you before the procedure. Depending on the abnormal heart rhythm you have, a cardiac ablation procedure may not work. Even when it does work, it can take several weeks before your symptoms improve. Sometimes people need another ablation procedure in the future. You can usually return to work in about a week after your ablation procedure. This may be longer if you do heavy lifting or physical labor. Most people do well with cardiac ablation, and overall this is a minimally invasive procedure. Talk to your provider and your cardiologist if you have questions and concerns. Remember to call an elder. They've been waiting for your call. I'm Dr. Arne Vainio, and this is Health Matters.